Question 1. A patient is admitted with a severe benzodiazepine overdose. Which antidote should the nurse anticipate administering? A. Naloxone, B. Flumazenil, C. N-acetylcysteine, D. Protamine sulfate. Correct answer, B. Flumazenil. Rationale. Flumazenil is a competitive benzodiazepine receptor antagonist that rapidly reverses the sedative effects of benzodiazepines. Question 2. A child accidentally ingests a bottle of iron supplements. Which specific chelating agent is indicated for iron toxicity? A. Diferexamin, B. Dimercaprol, C. Penicillamine, D. Calcium disodium EDTA. Answer A. Diferexamin. Rationale. Diferexamin is a specific iron chelating agent that binds free iron ferric ions in the bloodstream to form ferrioxamin, which is safely excreted by the kidneys. Question 3. A patient on heparin therapy shows a critically high activated partial thromboplastin time, APT, accompanied by active bleeding. What is the drug of choice to reverse this effect? A. Vitamin K/B, protamine sulfate. C. Aminocaproic acid. D. Idarucizumab. Answer B. Protamine sulfate. Rationale. Protamine sulfate is a positively charged protein that binds ionically to negatively charged heparin molecules, forming an inactive, stable salt complex that neutralizes heparin's anticoagulant effects. Question 4. During a suicide attempt, an individual ingested a large quantity of paracetamol, acetaminophen. Which antidote must be initiated to prevent fulminant hepatic failure? A. Atropine, B. N-acetylcysteine, C. Activated charcoal, D. Physostigmine. Answer B. N-acetylcysteine. Rationale. Paracetamol overdose depletes glutathione stores in the liver, causing the accumulation of the toxic metabolite. N-acetylcysteine acts as a precursor to glutathione, neutralizing and protecting hepatocytes. Question 5. A patient presenting with pinpoint pupils, respiratory depression, and bradycardia is suspected of an opioid overdose. Which medication will the nurse immediately prepare? A. Flumazenil, B. Naloxone, C. Methadone, D. Naltrexone. Answer B. Naloxone. Rationale. Naloxone is a potent opioid antagonist that displaces opioids from mu, kappa, and delta receptors, rapidly reversing life-threatening respiratory depression. Question 6. An individual is brought to the emergency department with severe bleeding secondary to warfarin toxicity. Which antidote is used for the sustained reversal of warfarin? A. Protamine sulfate, B. Vitamin K, phytonadione, C. Fresh frozen plasma, D. Idarucizumab. Answer is B. Vitamin K, phytonadione. Question 7. A psychiatric patient presents with severe extrapyramidal symptoms, AIIMS, due to haloperidol. Which drug acts as an antidote to reverse acute dystonia? A. Benztropine, B. Dantrolene, C. Bromocriptine, D. Amantadine. Correct answer A. Benztropine. Rationale. Antipsychotics lower dopamine levels, causing a relative excess of acetylcholine in the extrapyramidal system. Benztropine is an anticholinergic agent that restores the balance between dopamine and acetylcholine, halting acute dystonia. A patient presents with blurred vision, excessive salivation, lacrimation, urination, and diarrhea after exposure to organophosphate insecticides. Which antidote should be administered immediately? A. Atropine sulfate, B. Physostigmine, C. Neostigmine, D. Edrophonium. Correct answer A. Atropine sulfate. Rationale. Organophosphates irreversibly inhibit acetylcholinesterase, leading to an absolute excess of acetylcholine. Atropine blocks muscarinic acetylcholine receptors to dry up secretions and restore heart rate. Pralidoxime, though PAM, is also given alongside to reactivate the enzyme. A patient undergoing cancer chemotherapy develops hemorrhagic cystitis secondary to ifosfamide administration. Which protective agent is prescribed to neutralize this toxicity? A. Mesna, B. Leucovorin, C. Amifostine, D. Dexrazoxane. Correct answer A. Mesna. Rationale: ifosfamide and cyclophosphamide break down into acrylate, a toxic metabolite that causes severe bladder irritation and bleeding. Mesna binds directly to acrylate in the urinary tract, neutralizing its harmful effects. A patient exhibits severe cardiotoxicity and dysrhythmias from a digoxin overdose. Which targeted therapy should the nurse expect to administer? A. Atropine. B. Potassium chloride. C. Digoxin immune fab. Digobind. D. Calcium gluconate. Correct answer: C. Digoxin immune fab, digibind. Rationale: digoxin immune fab consists of antibody fragments derived from immunized sheep. These fragments bind directly to free digoxin molecules in the blood, neutralizing them and allowing them to be cleared via renal excretion. An alcoholic patient is brought to the emergency department with suspected methanol, wood alcohol, poisoning. Which antidote blocks the formation of toxic metabolites? A. Ethanol or fameprazole. B. Disulfiram. C. N-acetylcysteine. D. Pyridoxine. A. Ethanol or fameprazole. Rationale: methanol is metabolized by the enzyme alcohol dehydrogenase into highly toxic compounds, formaldehyde and formic acid. Fameprazole, or ethanol, competitively inhibits alcohol dehydrogenase, allowing unmetabolized methanol to be cleared safely by the lungs and kidneys. A patient experiences malignant hypothermia during general anesthesia with succinylcholine. Which skeletal muscle relaxant is the definitive antidote? A. Diazepam. B. Dantrolene sodium. C. Pancuronium. D. Baclofen. B. Dantrolene sodium. Rationale: malignant hypothermia involves a catastrophic, uncontrolled release of calcium from the sarcoplasmic reticulum into skeletal muscle cells. Dantrolene works directly on the ryanodine receptors to block this calcium release, relaxing the muscles and lowering body temperature. A patient accidentally receives a massive overdose of methotrexate during a chemotherapy cycle. Which agent is used as rescue therapy to provide active folic acid? A. Folic acid. B. Leucovorin, folinic acid. C. Mesna. D. Vitamin. C. Leucovorin, folinic acid. Rationale: methotrexate inhibits the enzyme dihydrofolate reductase, preventing the conversion of folic acid to its active form, tetrahydrofolate. Leucovorin provides an immediate source of active folates, bypassing the blocked enzyme to rescue healthy bone marrow in G cells. During the management of severe preeclampsia, a patient receiving magnesium sulfate develops a loss of deep tendon reflexes and respiratory depression. What is the immediate antidote? A. Calcium gluconate. B. Sodium bicarbonate. C. Potassium chloride. D. Calcium chloride. Correct answer: A. Calcium gluconate. Rationale: hypermagnesemia antagonizes calcium ions at the neuromuscular junction. Administering calcium gluconate directly antagonizes the neuromuscular and cardiac toxic effects of excess magnesium ions. A worker in an industrial plant is exposed to cyanide gas. Which of the following acts as a modern, direct antidote for cyanide poisoning? A. Hydroxycobalamin. B. Amyl nitrite. C. Sodium thiosulfate. D. Methylene blue. Correct answer: A. Hydroxycobalamin. Rationale: cyanide binds tightly to cytochrome oxidase, halting cellular aerobic respiration. Hydroxycobalamin contains a cobalt ion that aggressively binds to cyanide, converting it into cyanocobalamin, vitamin B12, which is non-toxic and excreted in urine. A patient is admitted with dark brown blood and severe tissue hypoxia due to methemoglobinemia induced by nitrates. Which antidote restores hemoglobin to its normal state? A. Methylene blue. B. Deferexamin. C. Dimercaprol. D. Vitamin C. A. Methylene blue. Rationale: methemoglobinemia occurs when the iron in hemoglobin is oxidized from the ferrous state to the ferric state, disabling its oxygen-carrying capacity. Methylene blue acts as an electron donor, accelerating the enzymatic reduction of methemoglobin back into normal hemoglobin. Question 17. A patient accidentally ingests rat poison containing a heavy metal like arsenic. Which chelating agent is best suited for arsenic poisoning? A. Penicillamine. B. Dimercaprol, BAL. C. Diferexamin. D. Editate calcium disodium. Correct answer B. Dimercaprol. Rationale: Dimercaprol, British anti-Lewisite, is a heavy metal chelating agent with sulfhydry L groups that bind to arsenic, gold, and mercury, forming water-soluble complexes that are easily excreted. A patient on a psychiatric unit develops life-threatening lithium toxicity. What is considered the primary, definitive clearing intervention, antidote for severe lithium overdose? A. Sodium bicarbonate. B. Hemodialysis. C. Calcium gluconate. D. Forced diuresis with furosemide. B. Hemodialysis. Lithium is a small, water-soluble monovalent cation that is not bound to plasma proteins. Because of its structural properties, there is no chemical antidote, and hemodialysis is the definitive, highly effective treatment to clear severe toxic levels from the blood. A patient is brought to the emergency room with severe central nervous system depression from a barbiturate overdose. While there is no specific chemical antidote, which treatment accelerates drug excretion? A. Urinary acidification with ammonium chloride. B. Urinary alkalinization with sodium bicarbonate. C. Hemoperfusion alone. D. Magnesium sulfate bolus. Correct answer B. Urinary alkalinization with sodium bicarbonate. Rationale: barbiturates, like phenobarbital, are weak acids. Infusing sodium bicarbonate alkalinizes the urine, causing the drug to become ionized, charged, within the renal tubules. Ionized drugs cannot diffuse back across the lipid membrane into the bloodstream, forcing rapid excretion. A patient being treated with dabigatran, a direct oral anticoagulant, experiences a life-threatening gastrointestinal bleed. Which specific reversal agent is indicated? A. Idarucizumab. B. Andexanet alpha. C. Protamine sulfate. D. Vitamin K. A. Idarucizumab. Rationale: Idarucizumab is a humanized monoclonal antibody fragment designed to bind specifically to dabigatran, neutralizing its anticoagulant effect within minutes. Andexanet alpha is used for factor XA inhibitors, like rivaroxaban and apixaban. A patient shows severe neurological toxicity from lead poisoning. Which oral chelating agent is commonly preferred for outpatient lead chelation therapy in stable patients? A. Sexcimer, DMSA. B. Dimercaprol. C. Diferexamin. D. Penicillamine. A. Sexcimer, DMSA. Rationale: Sexcimer is an effective, water-soluble, oral chelating agent designed specifically to bind lead and enhance renal excretion. It is preferred for outpatient pediatric and adult lead poisonings without encephalopathy. An industrial worker experiences acute copper poisoning, Wilson's disease-like manifestation. Which chelating agent serves as the antidote? A. Penicillamine. B. Diferexamin. C. Sexcimer. D. Atropine. A. Penicillamine. Rationale: Penicillamine is a copper chelating agent used clinically to treat copper overload states, such as acute ingestion or Wilson's disease, by promoting urinary excretion of copper. A patient accidentally ingests a massive dose of beta blockers, presenting with profound bradycardia and hypotension refractory to atropine. Which antidote bypasses beta receptors to increase CAMP? A. Epinephrine. B. Glucagon. C. Calcium chloride. D. Insulin glucose infusion. B. Glucagon. Rationale: Beta blockers prevent the generation of CAMP in cardiac tissues by blocking beta adrenergic receptors. Glucagon binds to separate, distinct non-adrenergic glucagon receptors, stimulating adenylate cyclase to produce CAMP, which directly restores heart rate and myocardial contractility. A patient develops profound bradycardia and cardiogenic shock due to an overdose of calcium channel blockers, CCBS. Along with calcium, which high-dose therapy serves as an antidote. A. High-dose insulin euglycemia therapy, HIET. B. Glucagon infusion. C. Sodium bicarbonate bolus. D. Atropine infusion. A high-dose insulin euglycemia therapy, HIET, rational. Calcium channel blocker toxicity disrupts myocardial carbohydrate metabolism, preventing cardiac cells from efficiently utilizing fatty acids. High-dose insulin shifts cardiac metabolism toward carbohydrate utilization, drastically improving myocardial contractility and blood pressure. Co-infusion of glucose prevents hypoglycemia. A child is rushed to the emergency department after ingesting a toxic amount of tricyclic antidepressants, TCAS, demonstrating a widened QRS complex on the ECG. Which antidote is critical to prevent fatal dysrhythmias? A. Sodium bicarbonate. B. Calcium gluconate. C. Lidocaine. D. Amiodarone. Correct answer, A. Sodium bicarbonate. Rational. Tricyclic antidepressants cause severe cardiotoxicity by blocking fast sodium channels in the myocardium, leading to a widened QRS complex and fatal arrhythmias. Sodium bicarbonate increases extracellular sodium concentrations and raises blood pH, which detaches the drug from the sodium channels, stabilizing the cardiac membrane.